Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini. Welcome all.
So, today, we're going to talk about something super fabulously interesting. Everybody's going to be on the edge of their seats. You came up with this title, Doc. I'm going to let you say this title.
The title is Risk is Not Just a Game.
Ooh, think about that.
Think about that. Next to Monopoly, the most popular game there is.
Ooh. Now, this is an overview of risk management. Before you hit pause or stop on this podcast and say, this is boring, I don't want to hear about this. Trust me, we're going to make it as lively, exciting, and informative as we can because that's what we do.
That's what we do. And relevant. Once you hear all that's involved in this, you're going to recognize that knowing is better than not knowing, and doing it well is better than doing it wrong.
There you go. So I guess the question...
we can just roll up.
Right? Yeah, right. Hey! The question I have out there, docs, is do you pay attention to risk management? Do you look at it in your practice? Do you manage risk, or does risk manage you?
Great question, because it's obviously what we're talking about here today. You know, my particular perspective is simple. Do everything, put everything in place, make it routine, make it procedure, and then you're managing your risk. If you don't know what to do, you don't know how to do it, and you're not paying attention to it, risk is managing you.
You know, in sort of my everyday life beyond the billing stuff, when I'm out there with my wife doing these Dave Ramsey Financial Peace University things, and we're talking to people about the insurance segment, and they're like, well, should I pay for more insurance or should I not? Should I do this or should I not do that? And we always talk about it in the context of risk management. Or do you want to self-insure, meaning a higher deductible means less of a premium. But that means if something happens, you have to come up with that much more money at the time. You're taking the risk.
It's the old quarterly dilemma with your taxes.
Yeah.
Pay me now or pay me later.
Yeah, right. I mean, there's those people that just say, I'll worry about it later. And then they get the big tax bill at the end, the first quarter, and then have to figure it out. Or people like me, and I think like you, where you'd rather have it taken out every week. And
then some.
Yeah, and then some. Oh,
I don't like tax bills.
My accountant beats me up every year. Will you stop taking so much out? It's like, no.
No.
Because I've had those years where you're facing a huge tax bill with no way to pay it. And you're like, oh, thank you. So anyway, I digress.
That's true.
Let's look at, the types of complaints that would encompass risk management so we can kind of get our brains around this.
And I'm not sure a lot of people understand that there are different types, and they definitely have different impacts. So you could have like a civil complaint, a basic someone suing you, and most of the time it's about money. As when they sue you in that particular format, it's about money.
That's a pretty easy one to grasp. Most people know that, and it's funny. One time a doc had said to me, someone had said to him, if you can solve a problem with money, it's not really a problem. And when you're broke, you don't think that's true. Right?
Exactly.
But then as you get older, like myself or somebody else across the desk from me, you realize that when there's problems that aren't about money, those are the ones that are tougher to solve. Right?
Exactly. And if we were to add another civil type of complaint, or another word that we like to use is regulatory. So now all of a sudden you're looking at your license at risk.
You and I are both very familiar with this because you sit on a licensing board as a public member. You've sat on the chiropractic licensing board in our state. And I sat on a board. We do this stuff every month. And when we get into this, all right, we'll just wait. I'm eager to talk about some examples.
I know. It's like it's our life outside our life, Yeah. Another type of civil complaint is malpractice. And all three of those, like Paul just said, we'll say easily be remedied with money most of the time, or at least involves your ability to make money if your license was at jeopardy. So those are three types of civil complaints that you might have. And then there's the
big one.
boom, boom,
Yeah.
the criminal complaint.
So singing theme music from TV shows, I could tell.
Boom, boom.
Yeah. To me, this is the scariest of them all, because this means you're defending your life or your ability, not even just to thrive, but to stay out of jail.
Freedom.
That's a big one.
Yeah. And one impacts the other too, because a lot of times in criminal cases, if the allegation is severe enough, state boards have to suspend your license until such a time that the case is resolved. So now your criminal complaint also gets into your civil category.
Let's weave the timeline of a potential, right? So you get a malpractice kiss in the mail. Someone says you hurt them, right? So you get a malpractice, and those can take what, on average? I think, what did the attorney tell us? 2
to 3 years.
3 years?
Years.
Okay. So while that's going on, or even at the conclusion of that, you get on this database, this what they call Sinbad or something like that.
Database.
And then your state board, whatever state you practice in, gets this list, and they get to take a look at what was this malpractice, and should we now take a look at this doctor and take action if we need to. So now you've gone through 2 to 3 years of sweating out perhaps a malpractice. It's finally resolved. And then you get another kiss in the mail from your state board saying, we're going to ask you for an order to show cause, because guess what? We see this issue, and we think that perhaps you might have broken some of the rules or regs, and we'd like to take a look. And of course, once they're inside your life, your records, it can become more than just the malpractice case itself. It can become other things like documentation, cooperation. And on top of it all, you just spent 2.5, 3 years. Now you've got to fight again to perhaps keep your license or keep from being sanctioned in your license.
And if we were to carry it to the most extreme, even after the regulatory complaint is settled, the patient can still sue you civilly for money. So in this crazy world that we just outlined, all 4 categories get involved. So risk is not just a gain.
Right, because if you were to overlay criminal as the start of all of this, that you got to sweat that out. Pay, you've got to defend yourself. Then all of a sudden, they're like, "Well, we're just going to go after you about malpractice now," because the standard there is different than criminal as far as any guilt. And then, as soon as that happens, the state board's looking at you. They'll pend probably your docket until there's resolution to either or both. I mean, this could be.
And then if they win
years.
that, if they do something, now the patient has the motivation to sue you civilly if there's some type of permanent damage or impact to their standard of living.
We're talking about years of your life.
Yeah.
Have we scared you yet? Please, maybe you've tuned out. I don't think so, because now we've got you on the hook.
And it's not meant to scare you, because it is up front at this point in the podcast. It is, but we're going to talk about all the ways that you just build it all in. So you don't have to be scared. You don't have to worry about this, because it's all just part of what you do.
And I'm going to dare say that some docs out there are maybe already doing some of this, but not consciously thinking that this is under the category of risk management in my office. But it is.
Yeah. They think that because I have malpractice, I'm covered. That's it. That's my risk management. I have a good malpractice policy. And as you saw from what we just talked about, it certainly doesn't cover everything we just spoke about, let alone whether or not your malpractice insurance itself is good enough.
And if you're a doctor out there that says, well, I've got a good reputation. I've been, stayed clean and out of trouble for years. People respect me. People respect chiropractic these days.
Blah, blah. We all have patients that love us. And unfortunately, we all have patients that may have a complaint about us.
Well, and in general, we know that how is chiropractic looked at by the general population?
Well, in the beginning, obviously way back, and depending upon what state you're in and when your licensures came into effect. But, in Massachusetts, where we're based, we're the 3rd to the last state to be licensed, which meant that my particular field doctor back in the day practiced 3 years before licensure was even in the state, which meant he was practicing medicine without a license. So things go way back then, and nobody ever came to us first. As we always say, nobody ever came to us first. And I love to always open up talks by saying, the good news is we're not quacks anymore, but the bad news is we're not quacks anymore, which means when I started practice, nobody ever came to me first, unless it was a direct referral from an existing patient. But most of the time, medicine got to do our screening. And now, today, patients come to us first. We're responsible to do that screening. Are they supposed to be in your office? So we've mentioned this in other podcasts too, so I won't expand on it, but just recognize there is a greater responsibility today as a practicing chiropractor than there ever was.
That's an interesting point. So if you think about it, when chiropractic was growing up, so to speak, as a profession, as a licensed profession, because the patient went through the medical grind or the mill, so to speak, ruling out everything, right? Trying to figure out what's going on with this patient.
They ruled out everything but subluxation.
Yeah. They can't seem to help or solve the problem. So by the time they come to the doctor, the chiropractor, as you say, their screening is minimal because there's a folder full of data that says it's not this, it's not that, it's not this, it's not that.
We're there.
Where now that there's so much acceptance as chiropractors, mostly for neck and low back, that your primary portal providers, they can come directly to you. We're not talking about insurance coverage, just in general. And they may not have seen any other medical professional when they hit your office.
And to quote my favorite superhero, with great responsibility, with great power comes great responsibility. And it's true. And now we have greater power. They do come to us. They do see us first. And with that, we need to know that they are supposed to be there and that chiropractic is the treatment of choice for that particular moment in time.
And when they're coming to you, Doc, now, in general, what is their opinion of chiropractic or you or chiropractors these days?
It's interesting. Obviously, the ones that come in from other patients that love you will refer other people that have this predisposition to loving you. But unfortunately, we just had a recent poll that showed that only 33% of the population believe chiropractors are ethical. Wow. That's bad enough, right? Except that it's 8 points lower than the last time they did a similar poll 4 years before. I think it was 4 years before. So for the most part, we have an image problem when it comes to the public.
Now, would you say that most of medicine has sort of similar images or image problems or this downgrade in the...
Oh, everybody's downgraded.
Yeah. So don't feel like it's just chiropractors
It's not just
alone.
us, but even with the upgrade or downgrade, even if I add the 8% back in, I still don't think 41% think only 41% think we're ethical is any better. But the point is that there is at least some doubt out there still. And recognizing that medicine accepts chiropractors more than they ever have in the past, they might refer to you, but they're referring to you in a limited way. So all of a sudden they're saying, go to the chiropractor. It's okay to have them work in your back. Don't let them touch your neck. Don't do this. Have them do that. And all of a sudden we're relegated to a technician's role.
Do you think too, as a non-chiropractor and just thinking about, friends I've referred and people like myself, 20 plus years ago when I didn't know anything about chiropractic, somebody comes because they've got a musculoskeletal issue, a neck, low back, whatever. But then the doctor starts talking about other things that chiropractic can help. And they start going out on this limb about all the things that chiropractic can help when there's not been a foundation of understanding and education. I know I've had friends that said, I went to this chiropractor and he said he could do this, he could do that, help this and help that. And I just came because my neck hurt. And they just felt like the doctor was out there.
Well, and it's a perfect example of how people get in trouble when we start talking about some of the particular topics of risk management. This is one of them, is how you present your information and what information it is that you are presenting. Is it timely? Is it in the right place? Is it in the right order? Do people give them what they want so you can give them what they need? Quoting Jim Parker again, right? So to go in there and start selling them the whole ball of wax on day one, again, there was an approach that is still true today, whether you use their structured format or not, but it's in advertising, it's called repositioning. So they came in thinking, I only want my low back fixed, and maybe that's all they'll ever end up taking from you. But you have to bring them to a different place to understand chiropractic. And the reason why that's all important, and we go off on that, is that it's lack of understanding, which is usually the foundation of every type of case, whether it be civil or criminal.
It kind of goes back to where we've talked about meet the patient where they're at, right?
Right.
As opposed to where you want them to be.
Exactly.
It takes some time.
Yeah.
So when we're looking at, there might be doctors out there, even myself at points before I really had an understanding of this topic, that this is what malpractice insurance is for, doc. Like, why am I going to worry about all this? If they want to sue me, fine. I've got coverage. Good luck.
Yeah, that's a rock, right? So, and that's somebody from Massachusetts using only R's, which you're not supposed to be, right?
I couldn't understand a word you said.
Yeah, that's a rock. But, if you rely heavily on your malpractice insurance, which we all do to a certain degree, make sure it's a good one. It's amazing how many people are out there and don't have the proper type of insurance, claims made, occurrence, make sure you know the differences, that you want to be able to be covered even when your insurance policy stops.
I have a strong opinion about claims made policies should not even exist.
Shouldn't be allowed.
They're cheaper for a reason, not a good reason.
Right. You stop the insurance and you are no longer covered for things you've done in the past. That makes no sense.
And if you're like, I don't know what mine is, I should ask your carrier, look on your declaration page. Is it claims made or occurrence? If it's occurrence, feel good. If it's claims made, change it.
Change it. Just not even a debate about it. Yeah. Just change it. And, other things you have to look at. What does it cover? Most malpractice policies cover everything within scope of practice as defined by your state board.
Do you know what your scope is?
So just because your buddy in Kansas is covered doesn't, with the same carrier as you use, doesn't mean you're covered in Massachusetts. It's defined by scope of practice in your state board most of the time. Check that.
I think a good, easy example of that is there are lots of states that chiropractors can do acupuncture. Call it acupuncture, do acupuncture. It's in their state regs, it's in their scope. But in certain states like ours, that is a separate license. It is not included. You need a whole separate
policy,
the whole thing. So like Dr. Davini said, just because your neighbor in a different state, hey, go to this acupuncture course for me for the weekend.
Yeah.
No problem.
No problem.
Yeah. Go, but don't practice in this state.
Yeah. And then you start poking people with needles and you find out you're not allowed to.
Yeah.
Right?
Yeah.
You also have to worry about whether or not your policy covers board complaints.
That's interesting because there's
a big
boards.
It's expensive.
It can draw out, and I think one of the big carriers ended up a few years ago upping their amount of coverage to help doctors with these board complaints, right? Because they can be lengthy, timely, costly.
I can tell you just from experience that answering the complaint, we're not talking about defending the complaint. We're talking about just step one. You get a complaint, you call your lawyer, you draft a response.
Wait a minute. Because some people get a complaint that looks pretty benign, and the doctor just responds to it.
God. Oh, God.
You know that happens.
Oh, don't do that.
Yeah.
Never respond without talking to a lawyer because half the time we're stuck defending the things.
Stupid responses.
They're stupid responses in the response. The stupid statements in the response. But generally speaking.
But doctor, I know this patient. If I just reply to their email, they'll understand.
But thank you for playing.
Yeah, right.
Yeah, it's wrong. It doesn't happen that way. And most of the time, backpedaling is very difficult when things have already been said and what's been said shouldn't have been said. So make sure you're covered by your malpractice for board complaints because, like I said, just step one alone in today's dollars could be easily $10,000. And that's just responding. That's not defending.
One of the areas that I know as a massage therapist myself and with my coverage that isn't covered is any accusations on inappropriate touch or sexual issues of any kind, which as a male
Very
therapist in
common.
this world,
Yeah.
I mean, I see it on my board, unfortunately, too much now.
And
A
even in
lot
the
of that.
chiro board, unfortunately. Yeah.
Right. So,
Don't we have a podcast on that coming?
I think we have one.
Yes, on inappropriate touch.
Yeah. It just makes, and the other thing, so this was interesting because when we had a risk management class recently. It was so much fun.
Yes.
We did a mock board hearing.
Yes.
Oh my gosh, that was so much fun.
All the lawyers were there. My wife played the victim at the time. And
she looked like a victim, downtrodden. I don't know if it's because of the marriage or I'm just kidding.
No, she's just a method actor.
No, she was very good.
Yeah.
They all did. Oh man, it was in the crowd just really, it was hard to advertise what it was going to be because it was, it was so complex, but it was so, people just really enjoyed it.
One of the things that impressed me was, of course, it's a 12-hour weekend and we get into, the first 8 hours is lecture and talk and discussion and all of that. Last 4 hours was the hearing. But so all through the week, people, questioning, we're laughing, joking, everybody's having a good time. We even involve our vendors, because a lot of times they have input into the devices that they're selling or whatever. I said, and then the start of the hearing, you could hear a pin drop.
Yeah, it was very official.
All of a sudden, because we did have a lawyer playing magistrate, lawyer playing defense, lawyer playing prosecution. Yeah. And then we had a doctor playing the doctor and a person playing the victim. And it just got so serious because I think people started to feel the gravity of the situation.
Well, what was one interesting point that came out of all that with certain big carriers, their coverage, correct me if I'm wrong, you said that the doctor's in control of whether the claim settles or goes to court. Now, I know in my world of insurance and massage, these nuisance claims just get settled. And it's really irritating to us massage therapists who say,
Right.
I know it was a couple $1,000, easier for you, but for me now it's on my record.
And that's the thing. What about your friend with the PT friend?
My gosh. Wonderful PT, great friend. And he's an awesome clinician. But when he first came out of school as a physical therapist, like fresh, green out of school, and I blame supervision or lack thereof and wherever he was working, but he burned somebody with an ice pack. It wasn't a terrible burn, but it burned nonetheless. Malpractice, settlement. And now rewind, fast forward 20 years later, every time he revalidates with a carrier, Medicare, Medicaid, he has to put this explanation of what happened all those years ago.
The scarlet letter.
It just follows you everywhere,
Exactly. So we're trying to impress upon you that it's these things are important to know and not find out at the wrong time. Most people wouldn't be shocked to find out that malpractice doesn't cover any criminal complaints. So now all of a sudden you're paying a criminal attorney, which are not cheap, to cover you.
But worth it.
Civil complaints that are you're being sued for money. Malpractice wouldn't cover that most of the time. So you got to think about all of the possibilities that can come from this. So probably the walk away from this is, in addition to your malpractice, consider an umbrella policy.
I think anybody with any toys or anything they want to protect, umbrellas are cheap and they fill that gap, and that they're easy to get. Usually they're tied to like your car insurance.
Right. And they're big potential losses if somebody sues you outside your malpractice.
Oh, I've seen, because I'm in the billing world, and I've seen letters, patients come in with them, they're at fault, and it was a pretty good sized accident. Doesn't mean they weren't hurt themselves, so they're in for care. And they're like, what does this letter mean? And it was from their insurance carrier saying, you're being sued beyond your policy limits. We paid out your policy limit. We recommend you get an attorney. Good luck. And they're out. They paid the $20,000 for the big. Yeah,
I'm out.
And then you're like, okay, now what? If you had an umbrella policy, they're not out, or the carrier will resume protecting you who has the umbrella. So it's
real.
Yeah,
it's real,
and it's cheap. I mean, it's like insurance is like, everyone's like, pay so much for insurance. They're like lawyers. You don't want to deal with them till you need one or you need it, right?
Well, I think we go back to the point you made in the beginning was, are you going to save the money as your potential nest egg to cover all these things, or are you going to buy the insurance? And really, we all just buy the insurance, and you and I overpay our taxes. And,
nobody puts a nest egg away for risk management. I can tell you
how much do you put away? I mean, in this day and age, everything is expensive, and so are lawsuits.
Right. So let's just break it down about what are if we talk about, risk management, you talked about civil, regulatory, criminal, but where in my office, what does that mean? What does it translate to?
Well, we'll kind of mention some elements that you have to consider in risk management. And the truth of the matter is each one of these can be, and most likely will be, a podcast on their own. Okay, but just to make you aware that these are the areas of your practice, the elements within your practice that you have to pay attention to. For example, HIPAA violations. You do not want the feds coming after you. And with that in mind, Medicare. You do not want the feds coming after you. And your taxes. You do not want the feds coming after you.
No, you do not.
What about your clinical skills and techniques that you utilize? Where is your justification for using them and not using them? Obviously, that comes.
And how well trained are you in something new?
Yeah. All of a sudden, I took a weekend seminar in dry needling. I stick a needle in someone too close to the lung, and I collapse their lung.
That's a real example.
That's a real example, by the way.
But I got a certificate for my 12 hours.
Yeah. Well, you put the needle right through the certificate for all the good it does, right? And the point is that when you are forced to defend yourself, make sure that what you have as a defense is defensible.
Right.
How's that for using the word defense as many times as I could in one sentence, right? But yeah, you have, office procedures and policies.
Yeah. What was interesting is that risk management course that was so much fun with the mock board hearing. We had one chiropractic assistant in the room, and she was pretty amazed and learned a lot. And the doctor that she works for was also there. And I can tell you Monday morning, they literally made important changes. They changed where the informed consent came in. They put them in the room that made it easy. It was pretty cool.
We impressed on them.
Now, mind you, this is an office that we've talked to before about this, but when for some reason it hit them, as you say, when the hearing happened, and the attorneys are reading the transcript as if the hearing's occurring, and
this was real case, and they were using real words.
Yeah, it made an impression, which is what we were hoping for.
Exactly. And all of a sudden, most people sat there, at least in my mind, you sit there and go, "Oh, but for the grace of God, that could be me."
That is so true.
Right?
Yeah.
So, you have to worry about stuff like your procedures and policies, but then the personnel and training, which Paul had mentioned, and take it away, billing and coding.
That's a whole litany of podcasts, which we probably will break those down. But, the standard of, well, I got paid for it, so it must be okay what I'm doing, is not the standard for compliance and proper risk management.
You are definitely going to debunk that when we do the podcast on the back of the claim form.
Yeah, that'll be a fun one.
And all the legalities and all that you agree to by just sending a claim. So that's going to be a fun one. But again, rattling off the things to concern yourself with technology, especially with emails, text, modalities, x-ray, and AI.
Boy, I'll tell you that we should do another podcast on that because it's rapidly developing.
Ooh. I'm thinking maybe we'll just take the one we did and give it to AI.
Yeah. Make this better.
Yeah, make this better, right?
I don't know what you're talking about.
Max Headroom. I know. 90% of the people out there don't even know who Max Headroom is, right? We have carriers, documentation, state boards, patience. How many patients do you have that have their own little idiosyncrasies and things to concern yourself with? Advertising and social media.
Boy, that's a big one there.
Yeah. So let's talk about a few fun things that we know about that we've experienced in our lives, right?
All right. Yeah.
Go ahead. Give me a good example of one you have.
Yeah. Where do I start?
You have to remember, Paul is chairman of our licensing board, a massage board in Massachusetts. So it's the stuff that comes through.
I guess I'll impress upon people to understand that when you're in a regulatory proceeding, like a state board hearing, or you're answering an order to show cause, whatever it is, ultimately you're looking at up to a 7-member board that is deciding your fate. And it is on the preponderance of evidence, which basically means, do they believe your version or the version of the complainant?
Yeah, but trust me, I'm a doctor.
Yeah.
Well, they all are.
Yeah.
In one form or another. Yeah.
So, the complexion of the board changes, but that it makes a difference because most boards will have at least one public member. Dr. Davini is a public member on his dispensing opticians board, I believe they're called. And I think the public member is the most important person on the board because the whole point is public protection. So having a public member, someone who's not a licensee, looking at this stuff and giving their opinion, I think weighs a little bit more than people that are in the profession because they tend to fall into professional protection versus public protection.
Yeah, they stop remembering who they're protecting and start protecting the wrong side in a sense.
So I'll sanitize this example because I have to. I don't want to, but I will. Yeah, right. So we had right. So we had this case, and it boiled down to informed consent, like most of them do. And there was an expert witness on the plaintiff side, the board side, and an expert witness on the defense side, defending the massage therapist licensee. And it was really about informed consent. And, if something happens while a client is on the table, what do you do? What's the proper procedure for handling something that gets disclosed on the table rather than prior to?
I hope you're all sitting down for this one.
Yeah. So I'm reading the transcript of this hearing, and now when I say these expert witnesses, they're licensed massage therapists in the state, and they're giving their expert testimony on the subject matter they're being questioned on. And this one is about, okay, a massage client is on the table, you're massaging, and then they bring up a complaint that they didn't originally bring up. And that would cause the therapist to likely change or alter their technique. And perhaps it's a technique that the client had never experienced before. And should you or should you not commence with that treatment or that care based on their complaint? Right? So that's the scenario.
Yeah.
Chiropractors deal with this probably all the time, I'm sure. So
all of a sudden today I buy a shockwave and tomorrow I start using it.
Right. So, and that can happen, right? So
exactly.
Someone complains, well, I just went to this workshop, I can do something different. So the board or plaintiff's expert said that 100% of the time, you have to stop the massage, step out of the room, have the client get dressed, then come back in, have the conversation about that new complaint and what procedures or techniques you may use so they understand and are informed of all the risks. They acknowledge and accept or not. Then you step out of the room, they get back on the table to their undressed at a level of comfort, and then you resume. Now, as a massage therapist, I can tell you that would likely not be happening. That's not typically best practice.
Seems a bit extreme.
Yeah. So that's a bit of overkill, right? Yeah. That to me, that's not even a bit. That's just
plain old overkill. Yeah.
Now, the expert witness for the defense had the same question. What do you do if a client says something, tells you they have a complaint? You may have to alter your technique. It may go into areas that are, sensitive or private-ish. And what do you do? And his testimony was basically, don't skip a beat. Just tell them, okay, I can do that. We can work on that and go for it while they're still on the table, undressed under the drape. And his opinion was that the client is always in control of that session, and there is no power dynamic between the therapist and the client that would cause any issue because the client is always in control. And so, of course, you can just continue on and do what you want or do what you think they need.
So two, quote, experts on opposite ends of the spectrum here.
The completely opposite. The same case, the same questions, completely opposite opinions. Should I tell them their background?
Definitely. Because this is the kicker. The whole thing.
I won't say if I served with them or not, but both of these expert witnesses were polar opposites. Both served on the massage therapy board. So I was a bit shocked by both of their answers because I was like, well, wait a minute. Neither one of these to me are best practices or resonate with informed consent, because you're not going to stop and have somebody get dressed, take 15 or 20 minutes out of their session to talk about something. And then you're also to sit there and say that there's no power dynamic between a massage therapist who's standing and in control of this session and a client who's on the table, undressed to some level of undress with a sheet between them and you. You can't tell me that there isn't a power dynamic there that is going to resonate.
So let's not tell them the outcome of the trial, of the hearing.
No.
Because let's let them think about this. That all of a sudden you have two experts presenting before a board whose basically preponderance of the evidence only is the criteria, the standard.
That's it.
Which way would it go? We're going to leave you to ponder that,
right?
Because the whole point is, without proper risk management, it could go one way or the other.
It certainly could.
So it's a real thing out there, people, and we're not trying to make something out of nothing. Like Paul had mentioned earlier, things like informed consent and when it comes into play, and talking, your defense sometimes is, I have a friend who told me to do it this way. These things just don't work. So recognize that it's real, that it's something that can happen.
However, if you think my example was a little far-fetched, which is true, I would love to hear the story you tell about the x-rays, the doctor, and the gowns.
This one doctor, and I had just gotten off the licensing board at that time. Actually, no, I got to take that back. While I was still on the licensing board, I had to testify before a grand jury because this doctor, they had to decide whether or not they were going to indict this doctor. He basically convinced his patients that his x-ray machine was not powerful enough to go through a gown. So
what?
Yeah. It's x-ray, but not powerful enough. I can go through your skin.
Was
and
it
your
a
bone,
lead Was it a lead gown?
Yeah.
I don't think so.
And so finally, one patient complained, and the kicker about the whole thing was when you asked this patient, "Why did you do it?" And this was a middle 40s-ish type of professional woman, very well educated. What would be the common answer? What do I know about x-ray?
Well, I mean, the doctor said it doesn't, so of course, why would it?
Trust me, I'm a doctor.
Yeah.
Once this one doctor got indicted and it was in the paper, we had 45 more complaints come through in a matter of 3 months.
The Bill Cosby effect.
The Bill Cosby effect. I love it. So this stuff is out there. Sometimes it's real, unfortunately, but most of the time it's avoidable with good communication and good procedure. That's the walk.
They're almost similar examples. The only difference is somebody's vertical and somebody's horizontal because they're in a gown, they're in a compromising situation.
Authority figure telling you what to do.
Yeah.
Really. So, as our member moment in our closing, we have our member moments that we like to talk about. And I think probably the best might be to say something as simple as what I just said. Informed consent. So you have to have consent, which means it comes from good communication in the proper timing and in the proper sequence. And we will do a future podcast on informed consent, I'm sure. And make sure that your procedures and protocols are covering all bases so you don't have to think about it. So that risk management is not management. It's just what I do.
It really becomes part of your whole compliance program that's living, breathing, happening
real
in your office, because we're not telling, go expand your clinical knowledge, learn new stuff, use new stuff, but know that when it's new to the patients. It's time to upgrade and incorporate that into your procedures.
Absolutely. So we'll leave you with a quote from Abraham Lincoln.
Ooh.
It often requires more courage to dare to do it right than to fear to do it wrong.
Ooh.
So don't fear doing it wrong. Just do it right.
Smarten it up. That's what you're talking about.
Smarten up. Risk is not just a gain.
There it is. All right. Thank you so much for listening to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini. Thank you all.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.